Has been circulated. Mr. President, distinguished colleagues, the Senate, at its sitting on the Thursday, 18th February 2021, read for the second time the bill for an act to provide for the legal framework for the establishment of federal medical centers and for other related matters, SB 636 bill, and refers same to the Committee on Health, Secondary and Tertiary for further legislative action. The committee conducted public hearing on Monday, the 29th day of March 2021, in order to get the views and opinions of stakeholders and the general public on the bill. Mr. President, the bill seeks to, among others, provide an enabling law to regulate the development and management of the federal medical centers with the aim of setting standards for rendering intensive, effective, and efficient healthcare services to the generality of Nigerians. The bill, when passed, will provide an enabling environment that will facilitate the provision of general policies and guidelines relating to major expansion program of the medical centers. Apart from providing advanced equipment and facilities for diagnosis and medical treatment, the federal medical centers, as they are now and as they will be in future, will serve as training schools and institutions for advanced healthcare services. They will also provide laboratories, research, and experimental stations necessary for efficient national healthcare delivery. Recommendation, that's on the last page. After clause-by-clause consideration of the bill, which is made up of 5 parts, comprising of 28 clauses, a long title, a short title, and an explanatory memorandum, the committee recommends as follows. 1. Propose amendment to the following clauses: the short title, the long title, clause 3, 1K to N, clauses 14, 21, 22, 24, 25, 28, and the schedule. The committee inserted a new clause of explanatory memorandum and retained other clauses, which are clauses 3 to 20, clauses 22, 1A to C, 22, 2 to 4, 6 and 7, 23, 26, and 27. In conclusion, Mr. President, distinguished colleagues, the committee thanks the Senate President, the entire Senate leadership, and all distinguished colleagues for the opportunity given to us to serve in this capacity. I so submit, Mr. President. I so submit, Mr. President, sir.
Committee of the Whole considered the report of the Committee on Health on the Federal Medical Centers Establishment Bill 2021 and approved as follows. Long title as recommended, clauses 1 to 26 as recommended, interpretation as recommended, short title as recommended, schedules 1 to 2 as recommended, explanatory memorandum as recommended. Is this a true reflection of what transpired in the Committee of the Whole? Thank you. Framework to establish the federal medical centers and for related matters 2021 third reading taken and the bill is passed. Congratulations. Leader of the Senate.
Mr. President, my highly respected and distinguished colleagues,
Of the, at its sitting on 3rd day of March 2021, read for the second time the bill for an act to establish the National Dermatology Hospital Center 2021, SB 631, and refers same to the Committee on Health, Secondary and Tertiary for further legislative action. The committee conducted public hearing on Monday, the 29th day of March 2021, in order to get the views and opinions of stakeholders and the general public. This bill seeks to, among others, establish a National Dermatological Hospital in Garkida Adamawa State. When passed into law, the hospital will provide diagnostic, curative, promotive, rehabilitative dermatological services and training of dermatological personnel at all levels. Mr. President, distinguished colleagues, after a clause-by-clause consideration of the bill, which is made up of 23 clauses, the committee recommends as follows. Propose amendment to clauses, to the long title, to clauses 1, 2A to F, clauses 3, clause 4, 6, 12, and 23. Inserted a clause on explanatory memorandum, retain clauses 2, subsection 1, 4, sub 1, 3, and 5, clause 5, clause 7 to 9, and clauses 13 to 20. Deleted clauses 10, 11, and 12 from the proposed bill, and renumber the other clauses appropriately. Mr. President, distinguished colleagues, the committee thanks Mr. Senate President, the Deputy Senate President, and the entire Senate leadership, and all distinguished colleagues for the opportunity given to us to serve in this capacity. I so submit, Mr. President. Thank you, sir.
There is no need to say specialized.
Consider the report of the Committee on Health on the National Dermatology Specialist Hospital, Garkida Adamawa State Establishment Bill 2021 and approved as follows. Long title as amended, clause 1 as amended, clauses 2 to 21 as recommended. Interpretation as recommended, short title as amended, schedule as recommended, explanatory memorandum as amended. Is this a true reflection of what transpired in the Committee of the Whole? Thank you. Leader of the Senate.
Mr. President, my highly respected and distinguished colleagues, I rise to move another motion for National Dermatology Hospital, Garkida Adamawa State Establishment Bill 2021 to be read.
A bill for an act to establish the National Dermatology Hospital at Garkida for the prevention, diagnostic, curative, promotive, rehabilitative, cosmetic, allergy of all conditions and disease affecting the skin, and for other matters connected there with 2021 third reading taken, and the bill is passed. Congratulations. Leader of the Senate.
Mr. President,